Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over what is tetanus. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started, guys. So what is tetanus? So it is a bacterial infection that affects the nerve. Okay, it's commonly referred to as lockjaw disease and is often get this by the result of a puncture wound. Okay, so you have a puncture wound and something that is contaminated with Clostridium tetani. Okay, it creates an opening and it has easy access to get into the body. Okay, tetanus can be prevented with a simple vaccine. And if you ever get cut with something, you should immediately go and get your tetanus booster if you have not had one in the last 10 years. Okay, so when you have tetanus disease, it can cause muscle spasms ranging from mild to life-threatening. Okay, there's currently no blood test that you can get to see if you have tetanus, but treatment should start immediately if symptoms do start. Okay, so treatment can include a tetanus antitoxin. So the antitoxin, it comes from somebody who has the tetanus boosters. Okay, so it's like their antibodies that you're getting, and it will neutralize the toxins that are in your blood, but it will not reverse damage that has already been done to your nerves. So the nerve damage will be permanent. They'll also start intravenous antibiotics, anti-spasmodic drugs, and even mechanical ventilation sometimes if needed. If left untreated, tetanus infection can progress from mild spasms to whole body contractions. This can lead to suffocation and even a heart attack. So I have added here, as you can see on the screen, just some of the common symptoms. So lockjaw is normally the first, difficulty swallowing, shortness of breath, and body spasms. So symptoms of tetanus. So the appearance of signs and symptoms normally start after about day 10. So symptoms gradually begin to get worse within a 2-week period. It normally starts within the jaw and travels downwards through the body. So signs and symptoms of general tetanus include painful muscle spasms, tension of muscles around the lips, painful spasms, difficulty swallowing, rigid abdominal muscles. Progression of tetanus results in painful seizure-like spasms that can last for several minutes. Okay, these severe spasms are normally triggered by minor stimulation. Okay, so a loud sound, a light touch, a draft in the room, light. Okay, as the disease progresses, other signs and symptoms may include high blood pressure, low blood pressure, rapid heart rate, fever, and extreme sweating. So when should you see your doctor? So tetanus is a life-threatening disease. If you have signs or symptoms, you want to seek emergency care immediately. Okay, so if you've had a cut within the previous 10 days and start with signs and symptoms, please see a doctor. If you have a simple clean wound and you've had a tetanus shot within the last 10 years, you should be okay to care for that wound at home. Now, you do want to seek medical care for the following cases. If you've not had a tetanus shot within the last 10 years, you want to see your doctor for a tetanus booster. If you are unsure of when your last tetanus shot was, you need to go in, you need to call your doctor and see when your last one was. You have a puncture wound, a foreign object in your wound, an animal bite, or a deep cut, you will want to see your doctor. If your wound is contaminated with dirt, soil, feces, rust, or saliva, you need to go get that taken care of by a doctor, and they will want to give you a tetanus shot. If you haven't had one within 5 years, they like to give one. If you do have a dirty wound, it makes you just at high risk for tetanus. So they want to prevent this from happening because, once again, it is a life-threatening disease that is easily preventable. So that's all that I have for this video. I hope it did give you a better understanding of tetanus and when you should go in to get your tetanus booster when it comes to wounds. But that's all I have for this video. I hope to catch you in my next one. Bye for now.